Candice Helf. She is the National Health Federation, Western Executive Director, Western Executive Director of National Health Federation Canada, and I'm glad that she's right here with us here. Now we'll just start. Please be my guest, be our guest. We have many people here, Candice, and it's great that you can take this opportunity to speak to the WhiteRockReporter.com. So here we are on YouTube and anywhere else in the world. We need to get out and message here something. You are well. Maybe you can read or make a summary of the mission for, in this case, National Health Federation Canada.
Canada? Okay. Well, thank you, Johan, again for taking the time to do this, because we are in a very precarious situation as Canadians and as a health industry, and we really do and very must take action right now. And that's what it's all about. We can talk about all the issues, but the thing is we need to take action. To share a little bit about NHF Canada and who we are and why we've come together, I've been an activist and been in the health industry for 20 years, an activist on the international level, now on the national level, and my vision of NHF Canada and why we joined with NHF is to protect, to empower, and to educate Canadians, and to bring everybody together. That's the vision I've been holding for many years, because we've been so disjointed, the naturopaths, the chiropractors, everybody on their own. So I would really like to see, through our campaign and the strategies that we are embarking on, to bring all these people together, because it's time. As I said earlier in our past video, there is a lot of fear out there right now, particularly with the creation of the NHP Directorate in 2006.
Let me ask you a question. Sorry for interrupting you.
Yeah.
What is the fear based on?
It's intimidation that Health Canada has been putting on our industry. It's actually been going on for almost 80 years, but it's really heated up.
I beg your pardon? 80 years?
About 80 years. And actually the first story started with a nurse, Renee Casey, who had received a herbal drink, herbal medicine from an Ojibwe man. This was back in I think it was the 30s.
We were talking about Buffalo Bill.
Yeah, a long time ago. Anyway, she was so successful that this natural herbal combination healed her cancer, and she was, giving this formula to many people. Doctors would send patients to her; they couldn't do anything else for her, and she had such a successful
remission?
Of cancer, that after a few years, Health Canada came knocking at her door and told her if she continued to give this medicine out to people and help them, they would put her in jail. So this is the beginning, and there's hundreds of stories, Johan. But the thing is, today, it's gotten so bad that at one of the most recent raids, when the RCMP were there and they told the staff of this naturopathic clinic to sit down, the RCMP threatened the owners, saying, "We would kill you." Now, this is terrible, and this is where we've gotten to. It's gotten so bad. And when you say about the industry, why they're so afraid, well, yeah, it's the intimidation, the abuse that they've been doing for many, many years. It's just escalated. And we know that come February 1st, these inspections are going to increase. These raids are going to increase with the help of the RCMP, the National Pharmacy Association, and Health Canada. So this is our plea and call to people to become aware of these raids. So what National Health Federation Canada is doing is we're putting together a kit, if you want to call it, to help health stores, for example, be prepared and know how to deal with an eventual raid, because they are coming. We have got information that there's going to be somewhere in the neighborhood of, I think, over 100 new inspectors being hired by Health Canada.
It's over 120, I understand.
Is that what it is? Yeah. And so we need to be prepared. So this is why we're doing this video, to let Canadians know, what is going on, how they can, become empowered, what they can do. And I'd also like to mention about Bill C-36, if I can, Johan. Some of our viewers and audience may know about it, many may not. Basically, Bill C-36 is the reincarnation of Bill C-51 and C-52, which I want to thank the Canadians that came together and rallied together to make an awareness of that. The thing is, it was somewhat stopped, but it was reintroduced last January as Bill C-6, and has now been reintroduced as a consumer safety bill, Bill C-36. Now, I really want to mention...
You know, I have to say, I know that many people are becoming confused. They hear about B-52 and AC-320 and they think of aeroplanes, but C-36 is not the product coming out of Bombardier on the East Coast in Canada, is it? C-36 is a bill, and it is not money either. So tell us a little in detail. It's a bill constructed to bring forward what is the prime message.
Well, I'd like to read, this was a letter that was compiled by a woman in Ontario by the name of Taz. It's a letter to Parliament, to the senators, to the MPs, and I'd like to read this.
Please do.
Yes.
Right now.
If this bill is passed, then Health Canada will be given the power to do the following. And I'm just going to read from my notes here, Johan.
Yes, please do. You have a laptop here. You
Yes.
seem to be very well equipped, but you are still in the beginning of structuring your organization.
Yeah, we're in...
You are going to... how is your war chest? How are funds coming about here?
Well,
you have fundraisings going to...
This is what we need to start doing, a campaign to bring in members, to receive donations and do fundraising, because our strategy and campaign that we have is, like anything else, requires money. So we will need the help of people out there, whether it's the consumers, public. We are going to need that support. Can we stop this for 1 minute?
No, I cannot.
You cannot.
Unfortunately,
Okay, because I know
I'm
it's
not
my
going
laptop.
I'm not going to do that. I think
Okay.
that it would be a lot nicer if we
Okay.
could tell to the audience here that we will have a number of videos on the topic,
Yeah.
on the subject, and I think that this is important. Now, if you could just make a little, not necessarily, just read off. Do you
Yes,
have a
I've-
note on
yes, I do.
what the mission is?
Yes.
I think we will
The
finish.
mission of National Health Federation?
Yes.
Okay, our mission is to empower the industry, empower the people again, because people are so afraid and we've forgotten that the power is us. People need to remember that. The power is in the people, and there's more of us than there is of Health Canada or the pharmaceutical industry.
There is something you are doing in your communication technology here that you are bringing into play. You are dealing with social media. You talk
Yes.
about Facebook. You talk about Twitter. You
Yes.
talk about websites in general and
Yes.
emails, campaigns, and all of them, in essence, you are using now. And this
Yes.
is an international issue, and maybe you could just finish that by saying something about why would this be concerning people living in Germany or France or England, UK?
Well, that, again, could be a video on its own, but simply, yes, it is an international issue. NHF is in 9 countries. We have members in 20 countries. And I want to tell our listeners, in 1997, in Germany, they had as many health products as we do today. But now when you go to Germany or Norway, you can only buy 100 milligrams of vitamin C by prescription, and it's about $50 a bottle. That is what's coming here. I have been working, as I said, on the international level. I know what is going on around the world. It's the same thing. And so what I hope and believe is that what we do in Canada, what we accomplish, will be sort of a model for the rest of the world, and that is challenging Health Canada. They are the bullies.
And
right? And we need to stand up to the bully.
Sorry,
right? We're not going to take that anymore.
Sorry for interrupting, but
No
I
problem,
understand you are in the process of turning the table on Health Canada.
Absolutely. And what it is taking our power back. That's what it is. So I'd like Health Canada to know that, we're not afraid anymore, and there's too many of us. And the thing is, I'm a mother, and I am going to stand up. As I've always said, I'm doing this to protect my children and the future children, so they have access to these safe, natural products that my ancestors have used for thousands of years. And we should have the right as Canadians to have the choice to choose what we want to put in our bodies, feed our children, and no one should tell us otherwise. And so it is going to stop, and thank you, we are going to turn the table.
And the contact here for people clearly to get in touch, they can send
me an email at nhfcanada@gmail.com. Also, we have a Facebook page. We'd love to invite you to National Health Federation Canada. And also our parent company, which is NHF, is thenhf.com. There you can go up if you want to join and become a member. If you want to donate,
Is that www.thenhf.com?
yeah, thenhf.com, and that's where people can become members. We've
You
been a
say
Canadian...
the or you say the? T-H-E?
T-H-E.
Yeah, the, okay.
thenhf.com. So that's our parent company, that's who we work with, and that's where, if you want to become a member, and through that membership, you get a magazine that comes bi-monthly, and we have an email newsletter and events page. Thank you.
Thank you very much for talking to me.